Yeah, thank you, Shashi. And a very warm welcome to our viewers and our distinguished guest, Dr. Don Agcopra from Philippines. Dr. Don is a MD neurologist and founder of Low Carb Health Doctor, LCHD, a clinic and research center located in northern Mindanao, Philippines. Dr. Don is a practicing neurologist for more than 20 years, but in the recent past, he expanded his role by becoming a healer when he began publicly advocating the low carb or LCHF diets and intermittent fasting lifestyle for the reversal of metabolic disorders. He envisions a world where people understand the importance of nutrient dense foods, thus, they attaining balanced mental and physical well being, and where the true benefits of the low carb diet is an accepted norm based on real scientific data and evidence based medicines. So we are looking forward to a lot of learning from you, Dr. Don, for over next 30 minutes. So we can jump into the session, right? I mean, directly. So first and foremost, just wanted to understand for myself and our viewers, what was the key trigger for you to go low carb?
I am approaching low carbohydrate nutrition, Yogesh. First of all, hi to you, hi to all, hi to Shashi and Anup. I hosted them in a previous podcast before.
Yes.
Also to Art. Okay. So going back to your question, you can hear me?
Yes, yes, absolutely. Yeah.
Okay. So I'm approaching low carbohydrate nutrition from both a personal and a clinical standpoint. Well, when I say personal, it's from my own experience. I've been a neurologist for more than 20 years here in the Philippines already, and I'm sure my fellow doctors would be able to relate with what I am going to share here, as well as what I've been sharing with many others.
Yeah.
In the past 2-3 years already. So I developed metabolic syndrome. I'm sure for the past 3 days, metabolic syndrome has been discussed a lot already.
Yeah.
Though the awareness of the general public, as well as not just the general public, but many doctors world over are, it's not really that extensive with regards to metabolic syndrome and its root causes.
Yeah.
But so going back to my own personal experience, when I entered my late 20s and my early 30s, I started, gaining weight, and it's mostly the abdominal obesity kind of.
Yeah.
You see, my tummy is getting bigger and bigger. But all throughout those times, I thought I was really wondering what in the world is causing it, because at that time I was adhering to a more or less vegetarian kind of diet, which I would more particularly describe as a pesci polo vegetarian diet, because I eat fish and chicken meat because it's white meat. And then I eat eggs, but I avoid the yolk, the cholesterol, fear-mongering.
I know, yeah.
So that's my diet. But then I also eat a lot of, all kinds of vegetables, including the starchy ones.
Yep.
And the grains, like, there in India and here in the Philippines, we love rice.
Absolutely, yeah.
So that's my kind of diet. And all through those years, I think for the next 15, 20 years, I was gradually gaining weight. If you look at my picture there in my landing page, my website, it was really kind of big before, at least 20 pounds bigger than what I am right now. So there came a point in time wherein I also developed elevated blood pressure, hypertension. My BP was really 140, 100, over 110, 90 to 110, oftentimes.
Yeah.
And then initially, I was just disregarding it. I think it was due to stress, because I'm a doctor. I have to go see patients, even at midnight, stroke patients, a neurologist. And then, aside from that, when I was doing my laboratory tests, I also noted that my triglycerides was really almost always way up high, averaging between 180 to less than 200. That's quite high,
Yes.
So
Yeah.
so I was thinking my uric acid also was elevated. So I was thinking, what in the world is wrong with me? I'm sticking to this healthy diet because my main reason why I was doing that diet is my own father
Yeah.
had two myocardial infarctions, which
Oh,
is in lay person's parlance is heart attack. So he died from during his second myocardial infarction,
oh,
which was massive.
gosh.
That really left a deep impact on me. I was a neurology resident
Yeah.
at that
Yeah.
time. I said I wouldn't like to follow his experience because I was thinking he had a heart attack because of
Yes.
having fatty diet.
Yeah.
So eventually, I was thinking, what should I be doing? And if I had to go through my medical education, I was supposed to be starting medications already for prevention and all that.
Yeah.
But since I was doing my best to live a healthy lifestyle, including my diet, I was very adamant in starting medications
Yeah.
because in the first place, I was doing my best to have a healthy lifestyle because I wanted to avoid medications. And then there
Yep.
came a time that I was persistently hypertensive. So I asked around. I have many doctor friends, specialists in cardiology, specialists in diabetes, endocrinology,
Yeah.
from the university, which are already big names
Yep.
on right now, like president of a hospital,
Okay.
stuff like that. And then they told me I have to start medication. So it's the same thing. What was told to me, that's also what they were telling me, and
Yeah.
including friends abroad. So there came a point in time that I really had to start four medications really for hypertension, for cholesterol, statins,
That is. Yeah.
for uric acid,
Yeah.
and what was the other medication? I started three or
Hmm.
four medications,
Yeah. Yeah.
but then I was half-heartedly taking them, and then because of that drive to really understand what in the world is wrong with me, I made a deep dive back into literature. And these days internet is widely
Yeah.
available. You can go to journals, and surprise of all surprises, I saw lots of studies there that weren't taught to us in medical school, weren't presented in platforms both here locally in Philippines and
Yeah.
international conferences, including studies by, like, for example, Richard Feynman, your guest yesterday or the other
Yeah.
day, Dr.
Yeah.
Eric Westman. So many studies, including trials, that really documented that the low carbohydrate diet is the most superior diet in terms of
Yes.
uh, reversing metabolic syndrome, and promoting metabolic health. So it's like a disconnect for me. I had cognitive dissonance, what we call it in
Okay.
neurology. It's like you have evidence, but then it goes against your belief,
That's
what
interesting.
you thought. It's cognitive dissonance for me. But
Yep.
then if I was interested in healing myself, so um, what I did is I told myself I'll give this a try. Okay, I'll
Yep.
give this just 1 week. Okay, just 1 week. If
Okay. Wonderful.
it's balloony, then I wouldn't find any improvement in myself. And
Yep.
then there came a point in time wherein, like they say today, I was doing low fat, and then following day I strictly went low carb, like
Yep.
ketogenic level. I wanted to make myself my own guinea pig, you know.
Yep.
So for for the next 1 week, I was very anxious. It's like,
Yeah.
what in the world am I doing? I might be having heart attack anytime.
Oh.
You know.
Okay.
And surprisingly, after 1 week, you know what? My my blood pressure normalized from 140 to over 90 to 100. It became persistently 100 to 110 over 60 to 70 and all that.
Amazing.
Then, yeah, then I lost in 1 week time. I lost about 5 to 6 pounds of my
Oh.
weight.
Yeah.
And then, yeah, and then I was not hungry because I was following the low carbohydrate
Yes.
dietary healthy fats
Right.
regimen. And I was saying, oh my goodness, this is really amazing. And then I continued that for the next months, so on. So, about 2 to 3 months later, I reversed all the metabolic syndrome abnormalities that I
Yeah.
had. That's how amazing my own experiences,
Yeah.
and to to cut the long story short, thereafter I began advocating for the same with my own set of patients, which are mostly stroke patients. And if you know, based on discussions from your previous speakers, stroke is a late complication of metabolic and health. Metabolic syndrome. Most of the patients that I am seeing in my own personal practice are stroke patients. So I have one of my biggest eureka moment is my goodness, if not most, if not all of them had stroke because of metabolic syndrome. And if only I was able to do something in terms of improving their diet for the past 15 to 20 years, I could only think how many of my patients who are probably still alive now, and who did not succumb to severe stroke. So
so how long you been on this low carb or ketogenic kind of lifestyle?
So let's say I'm pretty recent to this compared to many others. Even have patients before who have already been doing the so-called Atkins diet. I've been doing this for the past 2.5 to 3 years, more or less, in a disciplined way, because I continuously have proven to myself that this is, as Ken Berry would say, this is the proper human diet. And being a physician, I am constantly on the lookout for evidence, and I do my best to apply that evidence in my own personal scenario.
And that
very amazing.
And that was the key trigger for you to basically start focusing on ketogenic or low carb as a key intervention in your clinical practice as well. I mean, from, let's say, being a neurologist for so long, like 20 odd years, and then also starting this as a therapy in your practice, clinical practice, is something which is really kind of unheard of. I mean, like we were discussing, there are very few neurologists in the world who are possibly combining these two therapies as such. So you want to basically reflect on that. What are the benefits that you're seeing while you are, let's say, embraced low carb or ketogenic diets as one of the therapies in your clinical practice?
I beg your pardon, Yogesh.
So my question was, what kind of benefits that you're seeing in your clinical practice as a neurologist, and when you combine, let's say, low carb or ketogenic diets with your patients in their healing as such? So what are the kind of benefits that you're getting to see in them, and in diseases typically to do with neurological disorders?
As I mentioned earlier, stroke is the bread and butter for us neurologists. So there are two kinds of stroke. That would be the ischemic stroke, or what we call cerebral infarction. So the blood vessel in the brain was obstructed by atherosclerosis. The second common type of stroke would be the hemorrhagic stroke, or the hemorrhage in the brain because of the ruptured blood vessel. And the most common cause of that would be hypertension, prolonged chronic hypertension that has been there for so many years already. If you look at these two mechanisms, atherosclerosis and hypertension, so you could easily relate that to metabolic syndrome. And knowing what I now know, metabolic syndrome, the primary driver would be insulin resistance. And then insulin resistance is due to chronically elevated insulin levels, or what is called hyperinsulinemia. And this is brought about by chronic intake of carbohydrate dense foods, especially the refined carbohydrate foods, which is common worldwide, not just here in the Philippines, and there in India as well, and even in Western countries. So for all my stroke patients, especially now those who have survived stroke, when I have placed them on low carbohydrate diet, there is a very, very powerful reversal of the manifestations of metabolic syndrome, especially hypertension, and elevated triglycerides, and being overweight and obese, which is a big risk factor also for not just stroke but also heart attack. In fact, the entire atherosclerotic cardiovascular disease spectrum. So because of that, there would be a whole lot less tendency for my patient to have a second repeated stroke, and
Yeah.
that works wonders. And not just stroke. Recently, I talked to Dr. Angela Stanton, who came up with her Stanton migraine protocol.
Yeah.
I was wondering how come many of my metabolic syndrome patients on strict low carbohydrate diet,
Right.
come those with migraines are also experiencing very, very, let's say, dramatic improvement in terms of the frequency. And then I was doing my research and I came across Dr. Angela Stanton. I hosted her in one podcast. Amazingly, the elevated carbohydrate levels, hyperglycemia, is
Yeah.
more or less a very, very important, what do you call this, trigger for
Mhm.
migraine headache attacks.
Yeah. Yeah.
And not just that, there are so many other things like brain insulin resistance, which eventually leads to dementia, Alzheimer's, Parkinson's. There are many studies, ongoing studies about those,
Absolutely.
uh,
Yeah.
which is really,
Th- So
mind-boggling.
yeah, this is really mind-boggling when it comes to, I mean, diseases which are supposed to be so chronic, so advanced, so complex, and can be healed with a dietary intervention, which is amazing. So can you just taking this thread forward, Dr. Don, can you unpack the two aspects that we discussed about? Like, I mean, one is what is wrong in today's food? Is it only the refined foods, or is it something which is regarded as healthy, like let's say grains or fruits? Are those also causing or triggering some of these issues? So that's the first part of my question. The second is, if not these, and we have been referring to, let's say, low carb and ketogenic food, so what usually that would consist of, let's say, in your country, or maybe anywhere else, right? So two parts to it. What is not happening in a correct way, what is to be corrected in terms of food or nutrition, and then what are the things which we probably would need to be consuming more to become healthy? Yeah.
That's a very, very good question you ask, Yogesh. Because in my own experience, I repeatedly do some experiments on myself, and I also get to do that.
Yeah.
I get my advantage is I have lots of metabolic syndrome patients because I'm a neurologist, and I get to observe them firsthand, the
Yeah.
response of my interventions, especially the low carbohydrate intervention. And my main observation is that even minor diminution in the levels of carbohydrate intake. Like, let's say I have patients who just for at the at, for at I'd say level 1, they just remove the sweet
Oh,
sugar
yes.
based drinks like
Yeah.
Coca-Cola, Pepsi, juices, iced tea, milk tea, and all that. I already I can already clinically observe a dramatic improvement in their
Yes.
metabolic syndrome. So the more severe the manifestations of the metabolic syndrome, and the lower the carbohydrate intake they applied in their
Yeah.
own lifestyle, the more dramatic the improvements I get among my own set of patients. So much that those who are sticking to the very low level of carbohydrate, like the ketogenic diet and the very
Yes.
low carbohydrate ketogenic diet, even the carnivore diet, which is I'd say almost zero carbohydrate.
Yes.
I'd say almost zero because there's still glycogen
Yeah.
in
Yeah.
some
True.
organ meat. So
Yeah.
the lower the carbohydrate, the more dramatic the improvement in metabolic syndrome reversal.
Yeah. Yeah. And any guidance that you provide to your patients, like when you say low, is it like any guidance, like maybe few 50 grams, 30 grams, anything on those lines?
When I apply metabolic syndrome, I say reversal because the five criteria for metabolic syndrome: hypertension, abdominal obesity,
Yeah.
which is measured by bigger waist
Yeah.
circumference,
Right.
uh, blood glucose elevation, elevated triglyceride, and low HDL levels.
Yeah.
I can dramatically reverse them with very low carbohydrate. diet. So the lower the carbohydrate level,
Yeah.
the faster, like when you say ketogenic, less than 30 to 50 grams of carbohydrates per day. So
Okay.
that means as much as possible, no more rice, avoid the fructose rich fruits. Just if they want to eat fruit, perhaps they can, uh, you know, eat avocado and
Yeah.
yeah, stuff like that.
Right.
So
Yeah. So is it one thing that comes to maybe our viewers' mind? Is it safe and sustainable? I mean, safe, probably you already mentioned that when you are increasing fat and protein, your most of the parameters that you mentioned, right? I mean, are getting into those are becoming range bound. So on that front, I think it definitely is safe. Is it sustainable and affordable? I mean, that is what I think many a times, I think all of us do come across that kind of a question. What's your take on that? I mean, is it sustainable, low carb, ketogenic diets?
yeah, definitely Yogesh, both sustainable and affordable. Because every now and then in my platform, I post low carbohydrate ketogenic level foods. Like for example, I make my own low carbohydrate ice cream.
Oh, wonderful.
Then people say, it's quite difficult to maintain that lifestyle. No, I'm just trying to illustrate that I can give myself some treats because
Yes.
I make my own low carbohydrate ice cream and I eat it. I get to enjoy it, but it doesn't mean that the lifestyle would be non-sustainable and non-affordable because there are so many low carbohydrate foods out there that are really very affordable, like the vegetable
Oh, yeah.
greens, and then here in the Philippines, chicken
Correct.
is cheaper than fish and meat, and other red meat too.
Excellent. Yeah.
So it's really sustainable, both sustainable and affordable.
Yeah. And
So
your YouTube channel is very vibrant with all those recipes. Though I think some of the foods are very much, I think, Philippine specific, but I enjoyed watching, including the ice cream that you referred, right? I mean, so that's amazing. So there is one more aspect apart from the neurological, I mean, diseases that we discussed. Philippines is also having a lot of prevalence of cardiovascular diseases and cancer. So, what's your take on that, and whether, let's say, these kinds of lifestyles, like let's say low carb and ketogenic, can that help, or is it helping over there in terms of, let's say, CVDs and cancers in Philippines?
yeah, definitely Yogesh, because I was looking at the most recent statistics. Like last year, 2022, the number one cause of death here in the Philippines is still myocardial uh, heart diseases, which
Yeah.
is heart attack, myocardial infarction, which still aligns with the global top one cause of death based on WHO statistics.
Yeah.
And then second, not too distant, second and third would be stroke or cerebrovascular diseases and cancer, as you say. So uh, hyperglycemia and metabolic syndrome is really plays a very significant role in the 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 development of these diseases. So if we
Yes.
reverse the root cause of metabolic syndrome, then we foresee that these non-communicable diseases would also
Yeah.
eventually decrease and diminish through the
True.
years.
Yeah, yeah. So one interesting aspect would like to understand while we are discussing with let's say esteemed doctors like you, what is the approach that you take? Let's say a patient comes into your clinic, how essentially that person is being let's say validated whether he or she is eligible for low carb or ketogenic diets. Any particular approach that you follow, or let's say most of the patients you definitely administer low carb or ketogenic as one of the therapies?
That's another perfect question you ask, Yogesh, because in my own practice, when I first see a patient that I eventually get to diagnose with the metabolic syndrome, I look at the laboratories, and then my initial my screening tool would be I look for any irreversible conditions,
Yeah.
because if there are already irreversible complications, I think my time and effort, because it takes time to explain to the patient that they have to
Yes.
improve their diet, and all that. So it takes at the very least an hour for me to see a patient if it is a
Wonderful.
metabolic syndrome patient.
Yeah.
So my first screening tool is there, severe kidney disease, like chronic kidney disease?
Yes.
Is this patient already, like, let's say, bedridden because of a severe stroke? Because in my opinion, and in my own personal practice, I limit my low carbohydrate intervention on those patients, really, because it's like the quality of life. My impact is much less
Yeah.
already. But for the greatest majority who still don't have those complications, I ask this number one question: uh, how many years more in your life drama would you like to live in this planet? Because
Yeah.
I want my patients to be self-empowered. Because if they are not motivated and they are not the ones who really would like to keep themselves healthy, I don't I don't see much role, much
Right.
significant role in me being their doctor. So once they are, I find that they're really motivated. Like, let's say some patients, I want to live up to 100, and then I see that they're really diabetic, hypertensive, all the metabolic syndrome manifestations. And then I ask them, are you willing to really improve yourself, improve your body, and then decrease your medications eventually? And if I get their cooperation, I intervene,
Yeah.
and based on my experience, I also give them a complete list of foods to avoid and to choose, because they are the low carbohydrate type of foods.
Yeah.
And out of that intervention, I see significant success rate. I'd say for those who really follow the low carbohydrate lifestyle, I'd say 100% success rate in my own experience. It's amazing. Yeah.
Amazingly encouraging to know that. And I think what you're doing, Dr. Don, is miles ahead, right? I mean, in terms of a clinical practice, I mean, you're essentially investing your 1 hour every patient for every patient, and then just making that person understand why we should be doing that, right? I mean, that's really very I would say unusual to hear from, let's say, the kind of practices that we see. But that's amazing. I just wanted to have probably a last couple of questions, a quick time check. So one is about Indians, right? I mean, in Philippines or otherwise, I mean, for India, any particular message that you would like to have for, let's say, improving our metabolic health?
Um, First message I usually give to everyone is, your health is your own personal responsibility. It's not your doctor's. It's not, it works a lot for me, because I tell my patients, I am not here to be responsible for your health. It's you yourself who's responsible for your health. And that applies not just to Indians, but to everybody, the whole
Absolutely.
world over. So when I see that they are responsible for their own health, I get dramatic results in their own experience. And then another thing, you in India and us here in the Philippines, we have a lot of common denominators. Like, let's say
Yes.
we love rice,
Yeah.
like there in India, I think biryani, and you have
Correct.
roti, all those foods that are really rich in carbohydrates. I think it's
Yes.
just a matter of understanding that these are, how I explain it to my patients: avoid poison. Sugar and refined carbohydrates
This
is
is
poison
poison.
to your body.
Yes.
Yeah,
Yes.
it's poison. So if it tastes, fantastic, would you still like to, swallow that poisonous, fantastic food? No, no, I don't consider it food poison. So my patients get to understand that better, and then it
Yeah.
makes it gives them bigger, you know, and more effective in
Yeah.
really impressing it upon them that you
Yeah.
have to avoid this
Yeah. So
foods.
thanks a lot, Dr. Don. And yeah, I'll just hand it over to Shashi and Anup for
Yeah,
final
yeah.
words.
Just few seconds left. Dr. Don, thank you very much.
Thanks,
And
Jesse, for
all this,
inviting me.
all this message coming from a neurologist is big. And I think in India, people listen to doctors, and that too, you're a super specialist, a neurologist. It has a lot of value. Thank you. And special thanks for the video which you have made for announcing this metabolic health conference of India. Thank you very much. Anup.
Yeah, thank you. Thank you, Dr. Don. And we hope to see you again and
You,
again in all the conferences that we would be organizing down the line. And as Shashi said, thank you very much for promoting us even before we went live. Thank you.
I just like to say this is my last words. We are in this together, so we have to work hand in hand, because we are doing this from the grassroots, and we are not industry sponsored. We are sponsoring ourselves to do this. So
Thank you.
power on.
Namaste from India.
Namaste.
Namaste.